Here we are. Hi, everyone. My name is Stephanie Foster, and I am really excited to welcome you today to the 2020 OTAC Annual Conference. You have landed in session 61, and today we're going to talk about treatment principles for the remediation of birth trauma on clients.
Hi, my name is Dr. Peg Bledsoe. I've been an occupational therapist for 40 years. I learned about birth when I was using sensory integration techniques, putting kids in ball baths, tire spaceships, going through tunnels, and I learned they would tell me about their birth. So having a number of kids do that for a couple of years and talking to a good friend, I discovered birth techniques and how you can identify, support, and help children relieve the birth trauma that they hold within their body and carry throughout life until it's released. So I appreciate the opportunity to share it with you.
And my name is Stephanie Foster, and I'm an occupational therapist who lives in Santa Maria. I work in a private practice out of my home called Kids Work Therapy. And my passion is helping children and families use non-medical interventions to be okay and to be able to succeed as children. My business is located out of my home, and that means that everyone in my family gets to participate in it as well. So I've included a picture of my family here. Here you'll meet my husband. Jim is a wonderful man, and we've been married 26 years, and he helps with all the financial side of the business. You'll meet my mother, who sits on my board of directors. And then I have 3 children, Nicole, Victor, and Marie. And they're all adult kids now, and they're all so much better at technology than me. In fact, Marie did help us quite a bit in putting together this cast for you, this recording for you. So here we go. Today, next 75 minutes, we're going to talk about understanding why this topic is so important. We're going to review normal development, what we expect of a normal, healthy gestational period for the neonate. We're going to look at types of birth, and we're going to look at how this period of time affects babies. And we're going to spend some time looking at what happens if things go wrong during your pregnancy. And then we'll wrap it up with treatment techniques. It was Peg's and my hope to do hands-on learning with you. But due to the nature of an online conference, instead, we're offering you 5 case studies. It's our hope that these 5 case studies will really help bring home how to work with that pre-birth and birth period with the children and any clients that you're working with.
Our overall objectives, we want you to understand periprenatal psychology in a developing child, look at normal birth, understand the effects of interrupting and trauma during the gestational period and birth of a developing infant, and we want to support your understanding of how treatment techniques can be implemented. What is really important, since this may be a new topic for other people or for you, what is really important is that you understand what is happening to you, as this may be new material. You need to take care of yourself. If you're feeling uneasy, breathing, antsy, have some emotional issues, please take care of yourself. Breathe, write down your concerns, learn, understand. You can use sensory diet activities such as stretching, gum chewing, chewing licorice, drinking water, jogging in place. Those will help you get better in understanding what is going on and help you focus on what we have to present. Womb ecology becomes world ecology. It is the belief in periprenatal psychology that how a baby comes into the world and how they are received will make a major impact on them as a human being. Dr. Thomas Verney is a psychiatrist who started the Association of Periprenatal Psychology, who has looked at the outcomes of birth and how it's affect his clientele. From that, we have developed the APA, which is Association of Periprenatal Psychology, and it shows how world ecology involving science, the relationship between organisms and their environment, really create a relationship which relates to the fetus and the environment in the womb. It is especially the mother's state of mind which will drive a healthy pregnancy and a healthy child. So come and join us in understanding how womb ecology becomes world ecology. So the principles of PP&E look at life as a continuum. It starts before conception and continues after birth. During this formative period, parents and babies are not isolated from each other, but they are fundamentally interconnected. Often I talk to parents and I say, have you talked to your baby? And they look at me like, what do you mean talk to my baby? Babies hear and understand everything that happens to mom. It is translated through the environment, through chemicals, through listening, through moving, through understanding. So a loving periprenatal experience inspires bonding, sensitivity to others, and long-lasting consequences for individual relationships and for society. It's not often I see a naturally born child without drug interventions. They are an amazing person, but we're here to show you what happens when we have intervention that interrupts the child's skills. Ultimately, womb ecology will reveal itself as world ecology. As the seed of peace or violence are shown by parents, and their models, such as teachers and caregivers during pregnancy, will influence that child and their ability to cope. So David Chamberlain is one of the key founders to the periprenatal psychology. He says that babies are mentally and physically healthy. They will help us join the world in world peace. Dr. Chamberlain has worked with periprenatal psychology and clients for over 55 years. He is one of our fathers of APA. Windows to the Womb gives you some really good insight into how babies develop and what it means for them to be in this world today. This is Dr. Thomas Verney. He is a psychiatrist. He and Dr. Chamberlain got together and met a number of times in psychological association meetings. And they started talking about, is your patient talking about birth? And they started gathering information, and over a period of number of years, they discovered that the parents were, or their clients were talking about birth. So from that, they created treatment techniques and organization, have written books. Thomas's biggest book is The Secret of the Unborn Child, which gives you another window into how children and infants and neonates understand the world through birth. A current trender is Dr. Wendy Ann McCartney. She wrote a book called Welcoming Consciousness. She really feels that the human develops really significantly during the prenate part and the first year of development. So she also talks about how birth does affect the human being and how we're really sentient, conscious human beings that gather all the information through our sensory systems to understand how we function within the world.
Thanks, Peg. Now let's jump into what does a normal birth look like. We're going to start by discussing what a uncomplicated, healthy labor and delivery looks like. There are 4 stages of labor. The first stage is also called the latent stage. This happens to be the longest stage of labor, as it can take up to 20 hours. If there are difficulties, it could last 24 to 28 hours. The baby starts the contractions to begin this stage, and these contractions will start out very mild and then increase in intensity as labor progresses. And for the baby, these contractions help to organize and get the baby ready for their long journey. The second stage of labor is transition. This second stage of labor occurs when the cervix becomes completely dilated to 10 centimeters. While all the contractions are happening, the baby begins its journey down the birth canal and the vagina. And medical professionals, including doulas, fathers, or other support, will be involved with the mother to help with timing for pushing and just general encouragement as she gets ready to deliver her baby. The third stage of the birth process is during active labor when the mother is pushing the baby out for delivery. The uterus contracts so that the uterus becomes really small, and as the space gets smaller, the baby comes out the birth canal. And the end result is that the baby is born. And our fourth stage of a healthy baby birth is the delivery of the placenta. So the placenta has wrapped and kept that baby safe and cushioned throughout the gestational period. And the end result after the placenta is delivered is that a new family is formed. And this family might include a mother, a father, and an infant. It might include other members of the family. But together, their journey into life and occupation has just begun. Now, here's some statistics about birth. On an every day, according to the CDC, on an average day in the US, wow, almost 11,000 babies are born. That's amazing in one day. Wow. Now, there are just over 1,000 babies born who happen to be preterm. And we call that less than 37 weeks gestation. Just under 900 babies are born with a low birth weight, and we might call low birth weight less than 5.5 pounds. 329 of those babies are perhaps born with a birth defect. Of the babies born preterm, 174 of them will be born in less than 32 weeks. That would be considered very preterm. 153 of those babies will be born very low birth weight or below 3.34 pounds. And here's a sad one. 64 of those babies will die due to some kind of complication before reaching their first. But here's the happy news. As we talk about birth and birth deliveries, there are two kinds that we mainly classify. One would be considered a medical-free birth or a natural birth. Natural births can occur either at home, in a birthing center, or in a hospital. This category just means that there was, other than general support and encouragement for the mother, there was no medical intervention. The other kind of birth that occurs is a medical assistance or in some kind of birth that required medical intervention. And these kind of interventions span the spectrum between the mother needing medication to deliver, could be something for an epidural, could be that is delivered in a spinal tap. It could be that the mother needed some Pitocin to continue the contractions, to help the contractions along. Other kind of interventions might be interventions during the actual delivery, and that could be delivery by forceps. It could be something requiring a VBAC, which is a birth following a C-section, so vaginal birth following a C-section. And another one of the major interventions that we see is an actual C-section. And those are done because something's not going well with the actual journey through the vaginal tract in the uterus. If you're talking about a natural birth or a medical-free one, the baby presents head down in the pelvis before delivery. The baby follows the birth and then comes out head first.
So now we're going to look at how babies developed. And this is a chart that looks at the kinds of stress that occur during different weeks and what will happen to the children. So there are different trimesters, different weeks, and these are the kinds of influences that will occur to make the baby different. Behavior issues, and you can also have self-regulation and behavior issues, because what happens that the chemicals that are released, the anesthesia, the kinds of things that interrupt the baby's being will alter their physiological and emotional and ability to function and regulate their body. So it does make issues that you will see that will carry throughout life. So as we understand, babies are sentient beings. They can see, hear, feel from 6 weeks on, believe it or not. They know a lot, they understand a lot, and it's one of the ways in which our system helps the baby orientate to their new life on the outside of the womb, because they will know voices, they will know people, because they've been welcoming them in for the 5 months of gestational growth prior to birth. This chart is important because it looks at the development of the neonate from the original ovum all the way down to what's developed in 38 weeks. And what's really important is that the trimester, the first trimester, is really about brain development, about organization. And so for that area, it's really important that mother does not do a lot of drugs. She stays happy, because that's going to be the development of the brain. And as the child develops, as you will see, some issues will show you that it may alter some of the physical being and part of the body. But this is a good chart to know, because especially with some of the cocaine babies or addicted babies, you can tell by the brain development and behavior exactly when the drug was introduced to the baby by the mom. So it's important to know the embryology aspect of development, because it will help you understand treatment and what you can do to help.
One thing we know about fetuses is that they are active and they are actively taking in information about their environment. Once that baby is conceived, it doesn't take very long before its sensory systems come online. The healthy, normally developing fetus will gain the sense of hearing at the 5th week of gestation. And its inner ear forms around the 10 to 20 week period. The sense of taste forms because the taste buds emerge from the tongue. And we know that this happens around 13 weeks old. Based on ultrasound studies, the fetus can taste what's going on in the amniotic fluid by about 4 months. And the researchers were able to identify fetus's responses to different chemicals in that amniotic fluid. The sense of smell is developed through olfactory bulbs, which are based in your nose and the nasal passages. And these become online at 13 weeks gestation. And it's been shown that a newborn full-term baby has a memory of smell during gestation. That's pretty interesting. The sense of sight, which develops from eye spots, come online about 28 days gestation. And these axonal connections are online and working between 8 to 10 weeks. That means that the baby has a sense of light and dark, even in that protected uterus. Now, the background senses, as OTs, we may remember that your 3 background senses are very important to the baby's, to our development, but often not known or talked about. So the sense of touch is your tactile system, which is your skin, that allows you to tell temperature and pressure. And the tactile system develops first thing as the baby is developing, and it is the most mature of all of the 8 senses, 7 senses. I'll talk about 7 senses today, by birth. Proprioception, which, as you recall, is the body's positional awareness. Where is my body in space? This one is, proprioception is developed throughout the gestation period and provides the infant or the fetus with continuous internal awareness of what's happening, how the mother's feeling any kind of pressure on her stomach. And then the sense of vestibular, which is our balance and equilibrium, that allows the fetus to know where the mother is moving. If the mother is in the car, if the mother is wiggling around. And we know from fetus studies that this emerges between the 5th and 14th week. Now, there are things that mother is exposed to that can provide an interruption of development. So here's when we might need to take a breath and just be aware that there are things that happen to the mother that the baby does get exposed to. These events might be pure prematurity, being born too soon, could be genetic influences, could be environmental exposure like smoking, and that's direct maternal smoking, or it could be secondhand smoke, alcohol, marijuana. And then there are events that happen during birth, and these could be the kinds of interventions. And I'm going to go through these with you individually. Here's an interruption of development, genetic disorders. Now, these typically occur accidentally where the genetic code is altered, creating a change in your physical, emotion, or intellectual development. I've listed a few of the most well-known genetic difficulties, and those include Down syndrome, sickle cell anemia, Tay-Sachs disease, or Fragile X syndrome. Here, this slide looks at how some environmental effects can affect the baby. According to the CDC, in 2018, maternal smoking can reduce the amount of oxygen and nutrients that go to the baby. And this is carried to the baby through the umbilical cord. Smoking can result in blood clots and difficulty with the venous system in that neonate. When the mother smokes, the baby gets a much higher concentration of nicotine. Alcohol is another substance that's very bad for your developing fetus. And the CDC has come out with recommendations that better to avoid it altogether. Excessive alcohol consumption can result in fetal alcohol spectrum disorder. And they've been able to quantify that up to 40,000 babies are born with fetal alcohol syndrome disorder. Results of FASD looks like your brain is slowing in the speed of its growth, can result in hyperactivity, difficulty developing motor skills, and learning disabilities. Kids with FASD also end up with mental retardation and mental illness. Psychological issues related to FASD include oppositional defiant disorder, conduct disorder, low frustration tolerance, and being overly pessimistic. Here's a slide on some of the other substance influences, and this one looks at marijuana use. There is absolutely no reason to use marijuana during pregnancy. CDC and other researchers have shown that there is a direct path into that baby. And this use of marijuana disrupts brain development in all areas, causes the baby to grow slower. These babies tend to have low birth weight and deformed brains. There are behavioral anomalies, including tremors, irritability, and exaggerated startle reflex. And in older children, they tend to have a higher rate of inattention and hyperactivity. Some of the other substances that babies can be exposed to include cocaine. And often babies that were born from a cocaine-addicted mother are born addicted themselves, and they have to go through a period of withdrawal when they're first born. Drugs like amphetamines or methamphetamines are highly destructive to the nervous system and the body parts, and these babies tend to be born with cleft lips, cleft palates, and birth defects. These babies also, when born, have poor sucking, difficulty with swallowing, and extreme irritability. And then, unfortunately, while women are pregnant, they also have accidents. Sometimes moms just trip and fall. Sometimes they get into motor vehicle accidents. And the stats on this slide just show the percentage of reported difficulties or injuries according to the CDC. But we know that there are lots more injuries that go unreported or don't require the emergency room physician. But they do end up impacting or can potentially impact what the baby's experience is.
So what happens with pregnancy is that you can have issues with the baby coming out. Some of the physical issues are brachial plexus injuries, and with the one baby on the left, you will see that there are various nerves that can be affected by the way the baby's turned and come out. We have another picture showing you that baby's arms and feet may come out, but you'll end up with a side or a CP. You can have other issues caused from vacuums, extraction. You're going to get a cone head or a hematoma listed on the cranium, which will then alter how the baby head is formed and how they move. And what is important is that mom has good nutrition. And with good nutrition, then the baby will grow and will be able to create and use the energy stored by the baby that's fed to the baby by the placenta and the umbilical cord. And it is crucial that babies get proper nutrition and so they can store fats and carbohydrates, which help their brain develop. And especially during the first trimester and the second trimester, it's really, really important. What happens when mother does not eat right is that you can have failure to thrive, poor motor development, poor feeding skills, and poor attachment disorders. Often when people grow up in life, they're not going to want to eat, they're end up bulimic or some form of feeding disorder or eating disorder because they feel too fat. And so often that's an issue with some of the kids I've seen is the parents' attitude towards food during pregnancy. So in birth trauma, what we want to look at is, what does Merriam-Webster's dictionary say? It defines birth trauma as physical injury, such as a cerebral hematoma, physical paralysis, a facial paralysis, clavicle fracture, which can be sustained during the birth process. Also, there's emotional psychic shock that can occur, as some psychoanalytic theories indicate, during the infancy in birth. Also, these two avenues will have a significant impact on the parent's outlook through life. So March of Dimes has done a really good job of looking at what happens during birth defects in a period of time. So every 4.5 minutes when a baby's born, they have birth defects. So it's just a chart to really come home. So it looks at, in 120,000 babies, you have one in every 33 that have a disability. So this is a picture of the United States and exactly where we see the kinds of disabilities that occur from 2016. So it gives you an idea. The key on this right-hand side will show you what the percentage is for each of those. Premature infants are very challenged little characters. 30 weeks to 37 weeks is considered prematurity. The CDC says 1 out of every 10 babies are premature, and they have looked at why, and they look at tobacco, substance abuse, stress, infection, and carrying more than one baby. Teen babies and women over 35 will have a tendency to have premature babies. And a lot of times there's low body fat, and they never really get heavy, and they will have a quality to their skin that's different, and also their bones maybe will show some issues, and they may be frail in responding to their environment. Their muscle tone is weak. They may be sensitive to sounds and movement in their environment, and they may have problems with sucking and feeding, and they may have problems with lung development due to the fact that their muscles aren't supporting the ability to breathe. So you could have some lung issues and some heart issues. And what we have here is 2 pictures of parents doing skin to skin, because they found that with neonates, and skin to skin is really a good method for supporting a child's development. So what we're going to look at next are the emotional aspects of birth. So emotional aspects of birth, it's interesting because most of us don't think they're emotional aspects, but what they're finding is we're having mothers and babies being identified with post-traumatic stress, and that is something really to consider. When you're an EI specialist or an OT working in homes or in hospitals or outpatient, you may have a mother and a child who come in and have issues, and the mother will be depressed, the baby will be fussy. Those are issues to look at birth trauma. Often if a baby has problems, the mother is moved from service provider to service provider with little carryover and communication between them. So it's really important that we look at the mother and the child as a working dyad, that they work together. And it's true, mother depends on baby and baby depends on mother. And so when a mother is having a difficult time coping with their child because everything in their birth and the first couple of weeks of life was not what they expected, then we need to support them and help them understand that we can provide information, we can listen to them because they need to be validated. And that's really important. And parents get challenged because adapting to a traumatic delivery will affect them for the rest of their life, depending on the delivery, because their dreams and aspirations of what they thought and what reality is will change their outlook. A lot of times, here's a study that was done by a psychologist in Australia, and he looked at C-sections at 3 to 5 year olds. And he did this because he was concerned that in preschool, they were having so many preschoolers come in with issues. After doing extensive research, he found that mother-elected C-sections ended up with babies that had issues with self-soothing, self-regulation, they were anger or depressed, and they had poor tolerance issues. And so that's something to consider. And he did 5,000 surveys and correlated 2,500 with these issues. Something to think about. So the kinds of treatment tools that we have as an occupational therapist is an opportunity to comfort an infant so they understand that we understand about birth and birth trauma, so it'll help the baby regulate.
Okay, so now's a really good time for us just to take a deep breath. That was a lot of information on trauma and things that could go wrong. And now we get to turn to the fun stuff. Here's the stuff that as OTs we tend to really like. We know that OTs work with clients of all ages to help people with their occupational performance. And we know that we can do this throughout our lifespan. And our job is to identify and evaluate the effects of this physical and emotional influences, those, of course, that happened before the child was born, and see how it affects them now. And it's also part of the OT role to provide intervention to help individuals gain their full potential. So what do? We gather information. I take a pretty comprehensive developmental history. I do that from a paper pencil task that the mother and father fill out before they come to my clinic. And then as part of my intervention process, I look for what the child is good at. I really want to gain and understand what really makes this child tick. And I also look at the problems. What's going on physically, emotionally, and socially with this child. And then I want to make sure that as an OT, I'm up to date on the most recent research so that I can identify quality evidence-based interventions. And then the fun part I always enjoy is treatment, getting into the ditches with the kids, providing the most appropriate treatment for that person. And of course, one of our jobs is to measure the outcomes, to make sure that we are doing effective service. We know that OTs work with people in many different ways. I work with children. So I work with kids one-on-one. I work with kids in small groups. Of course, now I only work with kids individually because I can't put two kids together if they're not related. There are times that I have families come in. And in my clinic, I always have the family included. I do not allow moms to drop their kids off. I always require an adult to be part of my therapy session. And one of the things I really work for when I'm that mom or dad in the session with them is empathy and understanding, because that's what helps us go the next step. Really takes a gentle and skillful therapist to really understand this child's journey before they were born, and what does that look like now, and how it continues to affect the child individually. So here are some ways that I work with children. I take a pretty good birth history with the mother, and I help the mom to understand how those events, in a very non-judgmental way, what happened during pregnancy, even far as back as conception, how that affects the child's functioning. I look at the belief systems from the mom and the dad, and I help them to understand how that can reflect on the child's functioning. I use sensory integration activities. I coach the families in oral motor interventions. I use the Beckman for desensitization around the mouth, and I have been trained in listening programs. Me personally, I use a therapeutic listening program and have had great results with children over 2 years old. Here are some more specific ways that OTs can use, can work with these kids. Craniosacral therapy, highly effective, but you do need some additional training in order to effectively offer craniosacral as a treatment intervention. One of the biggest and easiest to implement is empathy about birth. Just knowing that this child had a difficult time in gestation or a difficult birth, and being able to talk about it and bring it into the play really does release some of the energy around it. There's a lot of work on trauma-informed therapy and understanding, for the purposes of this talk, understanding how birth affects the child is very important. First off, you got to understand your own birth. What did you go through? And that's it has all the potential to be a wonderful conversation between your mother and you. And if that's not possible, then gather that information, again in a non-judgmental, just as a way to understand. And both Peg and I have done workshops in the past that cover this. So we were hoping this workshop would go beyond just that topic. It is important to understand the birth of the child you're working with. It's really important to use your nonverbal communication, the way that you hold your face, the way that you gently gaze at the child, the pacing, the speed at which you work with that child and match where they're at. And then also using your how you use your verbal responses to ground and help that child to be okay. I can't say empathy is important enough. And of course, if there's any of these areas that you want to know more about, please be sure to look at our reference list at the end so that you can find out where to get more training in this very specific technique. Peekaboo, here I am. Since both Dr. Bledsoe and I decided to call this the remediation of birth trauma, I thought it'd be fun and interesting for you to see hands-on what some of these sensory integration techniques are that we can use to help kids and their families understand and get through some of the trauma associated with that prenatal and perinatal period of life. So I thought we could take a field trip and visit the Kids Work Clinic. Like I said earlier, I set up the Kids Work Clinic in my garage and in my yard, and I really have transformed this space into a fun play space. And what I wanted to show you today is how I have changed a few very simple toys into birth games with the hopes that you'll understand that recreating the womb and birthplace really is something that OTs can do well. It just takes a little creativity. And that's something OTs are really great at, right? We can do activity analysis easy, like second nature, and then create fun birth games, activities for kids to recreate that time. I want you to think about that gestational period as a time that's supposed to be the safest time, the time when you're surrounded by warmth and love and safety while you're gestating in the womb. Think about that. And as you go back to your own workspace, see how you can recreate some of those safe places, just using your very simple creativity. So let's get started. The ball pit, what a wonderful, wonderful place to recreate a safe, warm, pressure from all angles space. Sometimes I bring my friends in with me and we hide, and then we go peekaboo and we find each other. Sometimes I just lay back and relax, feeling nestled. Now, Unfortunately, during this COVID period, I've had to close off my ball pit. I just haven't felt safe having kids in the ball pit. But back before COVID, I would have kids in here all the time. And I would play peekaboo. I would play hide and seek. I would play find the toy. Anything to get a kid to try a new activity, to feel safe, surrounded, and then add some fun to it. Okay, now I'm coming out of the ball pit, and I'll show you some more toys. Here I am. Come on. There I am. Hello. Oh, well, that was fun. Here I am. So, whoops, what you just witnessed was one way, just one crazy way. Let me turn the voice sounds off. There you go, just one way to be creative with what you have around you. So I had the womb sounds playing from a YouTube video. And then I crawled through, actually under, 2 very heavy crash pads. And that was fun. You do have to forgive me. I'm just a crazy OT who loves to play and really not that tech savvy. But I wanted to recreate that journey, the journey of birth, as I crawl through the birth canal with lots of weight and pressure around me. And if I had another helper in the room, I might actually have the helper lay down, safely of course, but lay down on top of the crash pads so that we could recreate that journey through the birth canal to birth. And then of course, when I got to the other side, everybody in the room that was involved would make a big deal out of, hey, you made it, yay, I'm so glad you're here. Kind of recreating that birth experience. What do you think? Not that hard, right? Simple tools that most of us have in our clinic. If I didn't have a crash pad, I could use something else, right? I have couch cushions. We could crawl under couch cushions. Lots of choices. Okay, here we are back in the sensory integration room. I have mats all around me. And I thought we'd try out the egg. Now the egg is very much like being in the womb. You just put your kid in there, tell them it's going to be fun. You said, let's play. Okay, maybe we get into some peekaboo, peekaboo. And then are you ready to spin? And we go slowly. Taking cues from the child on how fast to go. Maybe we go the other way. And remember, vestibular activity can be very exciting, and it can be scary for some of our children. So we take the cues from the child. So this is just a spinning egg. I got this one from IKEA. So here's what I love about being an OT. I just can take my toys and make them therapeutic, right? So here's my tire swing, and the tire swing again is a womb space. It's circular, and the kid would sit on it and swing and feel movement. Forward, backward, round and round, fast. Stop. Oh, shaky. Just depends on what kind of movement. So here the child will sit inside the swing and be surrounded. Surrounded, safe, nurturing. And I find kids really love this kind of proprioceptive activity. They like to have control over fast, slow. They like the gentle rocking. And if the child needs something more, maybe I'll put a blanket in there and give him that extra deep pressure. Up next is the net swing. So I placed my friend, and for this demonstration, I'm just using a weighted bear. Put him in the net swing, and you do have to pick him up and put him in. And then you swing, and because I have a rotating top, I can circle too. But the net swing gives a really nice blend of proprioceptive input and vestibular input at the same time in a fun, surrounded, completely safe environment. Okay, let's see what we got next. Yes, everybody's favorite, Lycra. Lycra, you can buy Lycra. Now is probably a great time to buy Lycra since it's not bathing suit weather, but you can buy this at fabric stores. It's probably on sale right now. And you simply put the kid into it and let them sit. Where did my friend go? There he is. Hi, friend. So he's gonna sit in the Lycra swing, and he's going to keep his feet out because he wants to see what's going on. But there he is. And then he's surrounded, again, moonlight, creative. And if I were working with birth and birth memories, I might say, what does this remind you of? Kind of introduce it. Or I might ask the mom what this reminds her of. But here we are in a safe sack, in a warm environment. I'm keeping it quiet, and I'm swinging. That sounds like fun, right? Now, what would an OT clinic be without one of these? Everybody has its home. And when we're talking about birth, this could be that final birth canal journey. It could also be the beginning of pregnancy, which is that initial place where there's implantation in the uterus. So you would have your kid climb through all the way through. And then at the end, you make a big deal out of the exit. Yay, you made it. And sometimes kids are scared of going through tunnels. But most OTs know how to get a kid to eventually get through the tunnel. Now this is a hard size tunnel. It has a solid, background or frame. But I also have, again, some of my favorite Lycra. And I had my mother make me a Lycra tunnel because she has a serger. And we just made a nice Lycra tunnel so that the kids can crawl through it and get resistance in every angle as they crawl through, in every movement that they make until they crawl all the way through it. Now, if you want more information on how to make your own, I'll give you a reference at the end. I did publish this in the book with instructions on how to make your own Lycra tunnel. And just the last one of this kind of toy that I'm going to demonstrate. You may recognize this from Oriental Trading Company, or you could pay more and go to one of the fancy therapy companies. But this is a shape changer. And I love these because they come in all colors. And you just slip yourself in. There we go. And now I'm in the shape changer. There. I bet you can tell I'm a pediatric OT because I love to play. But this shape changer is highly, highly adaptable. Highly soft. I can walk, I can stand still, I can just push and get lots of proprioceptive input. Again, much like being in the womb. Okay, 2 more things I want to talk about before we're done with this part of the field trip. birth is an amazing, amazing issue, area to study, but it does require you to be in the here and now. And so for self-care for both you and for the kids, I often teach yoga. I use yoga as my way of getting mindfulness and to get into the very moment. And so I'm just going to show you one breathing method that we use from yoga, and that is alternate nostril breathing. I use alternate nostril breathing when things are getting a little bit scary, maybe a little bit intense. And all you do is you take your thumb and your ring finger and you put them on the sides of your nose, and then you take your two other fingers and put them in your forehead. And you breathe in through your left nostril, hold it, switch, lift your thumb out and breathe out on your right nostril. And then you breathe in on your thumb, hold it, out on your left nostril. I'm going to turn and just let you see it. You go. Hold it, switch, exhale. Inhale. Hold it, switch, exhale. And you would continue that for about a minute, maybe 10 rounds, and just see how the energy for yourself and in the room really kind of settles down so that you can really get through some of these larger triggering, perhaps traumatic events that are brought about by just talking about your birth. Okay, here comes the last one. In my clinic, I have a bouncy slide. 1, 2, 3. That was funny. So, I use the bouncy slide in a birth game because this might be one more way to experience just a normal final delivery into the world. You could recreate that final delivery in a fun, safe, creative manner for kids that were born by C-section and never had that final bouncy entry into the world. So I hope that you've enjoyed this field trip into the Kids Work Clinic. I'm going to give it back to Peg so she can go through the case studies now. And I really want to see, and it was really my hope that you would see how OTs really do have all the skills that we need to recreate a birth experience, but this time do it in a fun and safe manner, using the creativity and the skills that you already have.
So what we're going to do next is to provide case studies so you can understand how we see birth affecting a person and a baby. So again, when we look at it, emotional and physical influences on the baby, parent involvement, and hands-on working with the baby. And what's important is when I turn this page in my book of therapy, discovering how periprenatal psychology information and theory and how to develop birth games that really help children erase or release the trauma. So often, and we'll wrap babies up and kids up, they love doing the deep pressure. And both of these kids were C-sections, and they really like the deep pressure because it helps them define their body space. The child on the bottom, he required every pillow we had, and all four of us that were in the clinic at that time to lay on top of him. And he had to be that way for 10 minutes so he could be organized to participate in therapy. So the case studies we're going to look at emotional trauma during pregnancy problems, delivery problems, problems with mother's emotions and bed rest, and adult life, what happens there. So the first one I'm going to introduce is emotional trauma during pregnancy, called Do You See Me But Not Hear Me? This is a severe autistic child. The parents were planning on a big wedding and a honeymoon for 4 months, And then mother found out she was pregnant. And they had a discussion on and off for 4 months about whether to keep the baby or not. And we call that abortion ideation. And that was really challenging for this child. In the end, they ended up keeping the baby, but the birth was really stressful with prolonged labor and lots of pain, and dad was really, really unhappy. So he was diagnosed with autism at 6 months, and he had problems with speech and language. He didn't really talk to anybody. He used a communication system, so it was very challenging for him. So during our time together, I saw him probably about 4 years. And when he was 8, and I've been seeing him since 3, actually 7, I was in my clinic working with him on activities that he loved, and the aide and I were sitting there, and all of a sudden he banged his fist on the floor and looked at me. Now, mind you, he doesn't communicate. He said, "Peg," and I go, "What?" And he goes, "You have to stop." And I go, "Okay, my dad will never accept me." And he was right, because I had spent hours talking to his dad about birth and birth psychology, and his dad was a behavioral psychologist and knew that he could just use behavior intervention and that should fix the problem. And mom was with me, and so we were very creative in our birth issues and how to improve the child. But out of respect for the child, that was the end of me pushing any birth. And today he's 25 and he is in a board and care home playing music and doing what he wants to do without dad around. The next one I call the spicy meatball. It's conception issues. I saw this child from 2 years to 5 months or 5 years old. And what happened was that she wasn't going to have a child. She couldn't have a child. They ended up being pregnant once, and she lost the baby at 28 weeks. They ended up being pregnant again, unexpected. And so she was able to carry the baby until 32 weeks. But the problem was she had 5 months of bed rest. So she kind of did everything she could. She was fearful most of the pregnancy because she didn't want to lose the baby. So the delivery, when they induced the birth at 32 weeks, they had 33 hours of labor, and they spent 3 months in the NICU. And so my little spicy meatball was really angry with mom. She had problems with socialization with mom. What she would do, whoever held her, she would twist their skin. She would pinch and pull at them. And in looking at pictures in the her in the intensive care nursery, everywhere she pinched people was the exact place that they placed the electrodes on, needing to monitor her. So she was not a happy camper. She didn't drink water. She had gross motor, fine motor issues. And at her age, she was going to be worked up for obsessive compulsive disorder. I spent an intensive weekend with them, 4 days at 4 hours a day of treatment. At the end of our treatment, using alternative techniques such as craniosacral, myofascial release, NIS, and working on different emotional issues, my little spicy meatball was amazing. Halfway through and working with mom, the baby came over. She got off the swing with daddy and came over and told her for the first time that she loved her. And at that point, we got out the Kleenex box. So you can really make a difference. She was not diagnosed as obsessive compulsive after that. Right now she is 27 years old and she's doing really well. She does have visual problems, she does have learning disabilities, but they've worked through that she's able to hold a job, and she did get an AA degree in animal husbandry, so she works with a vet, so that's exciting. Our next problem was a delivery problem, and everything was fine. I saw this child at 18 months for early intervention team, the pregnancy went well, the child was happy, mom was happy, everything went well. But what happened was the child was stuck in the pelvic girdle for 36 hours. And as a result, she ended up with a C-section because she couldn't move. So what happened was this baby was moving around, and they would prop her up to sit up, lay her on her tummy to lay on her tummy, or her back. And what she would do is she could only move her arms and legs because she was unable to get her head to rotate because she couldn't move her head. So as a result, she wasn't eating, crawling, or walking at 18 months. She had food issues, and she talked very limitedly, and she wasn't able to move around, so you picked her up and moved her around. So in using craniosacral work and using empathy, lots of empathy, craniosacral work, myofascial release, she in 3 months or in 3 weeks was able to rotate her head, be able to roll, and move to crawling. And in another 5 weeks, she was able to stand up and walk. And the parents were real excited because mother wanted an expectation that her child would be like her cousin, which would be moving around and playing. And she was well on her way during that time. It was absolutely wonderful to see her be able to access her developmental patterns that she needed. And when she could access them, she moved quickly through the developmental stages. So this one is, wait, I can't move. And this was maternal stress and another bed rest problem. So here we have an 8-year-old boy. It was seen in a school-based setting. It was a great pregnancy, but a natural birth. And the baby was stuck in the birth canal for 3 hours. And so from that, this adolescent, when I saw him, is that he had anxiety during any transition. He didn't like to leave the house. He would hyperventilate, and he would be anxious over any change. So when he didn't feel connected to mom, and he didn't feel connected to the world. So in working with him in craniosacral myofascial release, he was able to redo his birth, reduce the anxiety that he had, that he was able to make transitions, he was able to go to school, he was able to begin to develop friendship, and he didn't feel anxious anymore. So he did much better. I'm not sure where he is now, but he did well, and he was able to cope better in going to school and working with his friends. Now this is a 36-year-old female, and she got craniosacral work done. Her gestational history was her mother wasn't sure about her pregnancy. She didn't know if she wanted to keep the baby. So again, we have abortion ideation. The labor was stressed and prolonged. There was lots of pain, but there was natural birth. And her concern was, the lady's concern was that she never felt like she was on earth. She was always floating around. So I worked in a multi-hands-on group, and so there were 5 of us over a period of 6 treatment sessions using craniosacral work with what we call a multi-hands-on group. She was able to resolve her birth issues, and on the last treatment, it ended up being the last treatment, she was able to go through her birth correctly. And what was amazing is that when she was done, her face looked different, she looked different, and she said she felt alive and she was on earth for the first time. So for her, it made a dramatic impact. She was able to get her work done. She was no longer disorganized. She had 2 kids. She was able to attend to them with the full attention that she wanted to. So no matter how old you are, birth work will help change your issues and your problems with the right information.
Wow. Thanks, Peg. That was a lot of information.
Again.
I guess in wrapping this up, both Peg and I just wanted to share that really the most important thing about working with birth and birth issues, especially as we integrate it with what we know about with OT, the most important thing is to understand how birth experiences can influence the child's development, influences family relationships, self-regulation, and overall happiness. For now, we just want you to breathe, relax, and give yourself some time to understand all this new information. What happens next is we'll have a 15-minute question and answer period, and perhaps during that time we can delve deeper into these case studies to really look at how birth and the events that surround birth affect you throughout your development. I did want to share with you our contact information. Both Peg and I put our contact information, including our telephone number, on there with a sincere hope that you will stay in touch. Feel free to email us. We do actually love to hear from people to see, does this information affect you? Did it put on a light bulb in some part of your practice? In your handouts, we have lots of references. Here's a reference for everything. We did give you a complete list of references in your handout. There's also references for the figures and pictures. And then if you want more activities, over this past year, I was able to publish a book that lists out 60 activities that promote calming and focus in children. And I have integrated a lot of these birth activities throughout this book.